Hello everyone, my name is Sherif Mahmoud and I am a clinical associate professor at the Faculty of Pharmacy. In this first lecture, I'm going to talk about the principles of patient assessment. So by completing this lecture series, you should be able to discuss the patient care process, describe the role of patient assessment in pharmacy practice, and describe the steps of symptoms and chronic disease assessment, and in turn with respect to history, taking the patient history, physical assessment, and lab findings. And also you will be able to apply the assessment skills to consistently and efficiently identify, that's number one, categorize, and do the priorities too of the drug therapy problems using the patient care centered approach. So what's patient assessment? So patient assessment is the process of methodically collecting patient information while also using clinical judgment and therapeutic knowledge to identify patients' actual and potential drug-related problems. So we have collection of patient information and then using clinical judgment and therapeutic knowledge to identify the DRPs or drug-related problems. So you need follow information, you need therapeutic knowledge, and the clinical judgment. Patient assessment is an essential component of patient care process, which is a framework for pharmacist practice. So what's the patient care process? So there are three parts. Mainly, first one is the patient assessment. So when you see a patient, you establish a relationship with the patient. Hi, my name is Sherif. I'm your pharmacist here. How can I help you? And then you discuss with the patient to try to identify why the patient is here. So identifying the patient goals. This is followed by gathering relevant patient information, like a patient history and so on. And then you assess the patient. And after you gather all the information, you assess the patient. Based on that, you will identify the DRPs or drug-related problems, and then set the priorities specific to that patient. Once you assess the patient, you come up with a plan. So developing the care plan and implementing. Care plan development and implementation. So what do? You have the DRPs, how to fix it by identifying alternatives and looking at the alternatives, look at the pros and cons of every alternative and try to choose based on that. And then you develop the care plan and then you implement the care plan. And we'll talk on those ones later lectures. After that, you monitor and follow up. Okay. So you had a patient that comes to you with a headache and you started a headache medication. You identified the alternative like acetaminophen and ibuprofen, and then you decided to go with acetaminophen. So, and this is the plan based on the alternatives, right? And then you need to monitor and follow up. So follow up with the patient if the patient is experiencing like the headache already relieved by the acetaminophen, or also to check if the patient is experiencing side effects. And so that's a simple example. And of course, in each stage of that, you need to document and then you repeat that process. So it's kind of a cycle, as you see here. Cycle starting from top, patient assessment, gathering information, and then you assess the drug therapy problems, and then after that you do the care plan, which is developing and implementing the care plan, and then monitoring and follow up. Okay, so why patient assessment? Why pharmacists needs to have mastered the skills of patient assessment? So pharmacist roles as healthcare practitioners expanding. We all know that. They have more and more involvement in care of patients. And in some jurisdictions, they actually do prescribing as well. Pharmacists are the most accessible healthcare professionals. You want to speak to a pharmacist? Just go to a pharmacy. Simple. And then also like there are evidence that showed that pharmacists' involvement in patient care can make a significant difference to patient care, resulting in improvements in patient outcomes, which is great. So like actually when pharmacists get involved in patient care, that actually could improve patient outcome. Is there an evidence for that? Like, yes, there's lots of evidence on that. As you see here, like pharmacists involved in patient care, it's actually improved the care for patient with diabetes, heart failure, hypertension, osteoporosis, pain management, and more. So pharmacist involvement is very important. And based on that, they have to assess the patient appropriately and correctly. So there are many roles the pharmacist could do in order to assess the patient. Identifying actual potential drug-related problems. This requires patient assessment, right? You need to assess the patient to identify the problems. The second one, monitoring and managing patient drug therapy for chronic disease. Let's say the patient has a chronically has hypertension, and this hypertension has been diagnosed for the last 3 years. So each time the patient comes for a refill, this is a good opportunity to assess the patient. Is the blood pressure under control? Is the patient taking medications as prescribed? Like in terms of patient adherence, is the patient experiencing any side effects? So these are good opportunities for patient assessment. And also assessing patient for appropriateness for self-care treatment or referral. So like, for example, patient comes to your pharmacy complaining of headache. Okay, so there are many alternatives, over-the-counter alternatives for treating headache, right? As I mentioned earlier, could be ibuprofen, naproxen, acetaminophen, could be no treatment. So you need to assess the patient. Is there any contraindications, allergies patient might be having that actually contraindicate some of the use of the medications? Okay. Also, counseling and educating patient about disease and drug therapy. You need to assess the patient. Like, you need to assess the understanding. Like, does the patient have enough knowledge of his new diagnosis? Because lack of knowledge might lead to lack of patient adherence, right? And poor control of the disease. So it's important to assess the patient in order to determine how much you need to counsel, like what kind of information you need to provide the patient with in order to assess the patient. Even like language barrier is an assessment, right? So if the patient, like for example, is English language, there's a language barrier, and probably there's some resources that you can print that in different languages about the new medication the patient is getting. Communication, if communicating effectively with other health professionals, right? In order, like when you are presenting a patient, like if you find out that the patient needs a certain medication, in order to communicate that, you need to provide a brief assessment and to present the brief assessment to the healthcare practitioner, the MD, for example, to make sure that you are getting the medication changed or a new medication added and so on. Okay. So important thing when the patient comes to you, you need to think about one main thing. Why is the patient seeking care, right? Why is the patient seeking care? And what is the reason for the referral or assessment? There are two things, right? What is the patient is seeking care? Like, why the patient is here? Like, I'm here for having headache, I'm having dry cough. I'm here to refill my hypertension medication. Those type of examples. And what is the reason for referral or assessment, right? So I'll give you examples in the next slide. What's the patient agenda? So what's the patient agenda? If this patient is like, this patient has time right now to do a complete assessment, or maybe you can address that in a future meeting, future visit, or maybe the patient like just doesn't have time right now and he needs something for his headache. Or maybe the patient has time, so you can do a complete assessment to the patient, I mean, full medication review, for example. And remember, there may not always be a new medical problem or an issue with the therapy, right? So patient comes for a routine refill. Sure, you can do like, a few minutes assessment. Okay, how is your blood pressure doing? Yes. Do you monitor it at home? Yeah, it's under control. Do you have any side effects? No, I have been on this medication for years. It's very helpful. So it's just an assessment, quick assessment, right? So as examples of why the patient is seeking care, for example, patient present to your pharmacy complaining of dry cough. Okay, I'm having dry cough, like what do I do? So we start collecting data to assess what medication patient may be needing, does the patient actually need a medication or not for dry cough. It's a symptom assessment, right? Patient comes to your pharmacy to refill her prescription. As I mentioned, like patient has hypertension, I'm coming to refill the amlodipine for the blood pressure. So it's a good opportunity to assess the control of the disease, the adherence, adverse reactions, and so on. Patient admitted to the hospital for pneumonia. You are now a hospital pharmacist, and patient comes to you like presenting with pneumonia. Okay, so you need to assess the patient and to assess what home medication do you need to start, what antibiotics, antimicrobials you need to start for that pneumonia, are they appropriate or not. If there is any hospital-specific medication you need to start, for example, DVT prophylaxis. So this you assess the patient in the hospital. Patient came to your clinic for a medication review. Now you can do a full medication review and go one by one and on the patient problems and see if there is a control, if there is no compliance or adherence issues, if there is any abnormal lab tests that need follow-ups, and so on. We'll discuss that in the next series of videos. Patient diagnosed a new onset diabetes. Now you need to assess the patient knowledge of diabetes and also assess the patient for the risk of non-compliance, non-adherence to drug therapy, and is the patient start on the appropriate management or not. These are all many questions that you need to assess for newly diagnosed conditions. Okay, we'll talk about that in more details. So based on what I discussed on different scenarios of assessment, in order to assess the patient, you need to do patient history, right? And this will be discussed in the next lecture. Symptom assessment. So how to do a symptom assessment using SCHOLAR. This is an acronym. Chronic disease assessment. So how to assess a patient with chronic disease. With initial diagnosis, you do the IASA, like indicated, effective, safe, and patient adherence. Follow-up assessment, you do the 2 CAs, which is the control of the disease, complications of the disease, adherence, and adverse drug reactions. We'll discuss those in more details in the next series of videos. How to do a complete medication review, we'll go over that as well. Go over some other assessments, assessing adverse reactions and drug-drug interactions. And as usual, like if you need further reading about patient assessment, the first couple of chapters in the book, Patient Assessment in Clinical Pharmacy, it includes details about the principles of patient assessment and the patient care process. Thank you.